Okay, I wanted to point out a couple of things when you're tractioning your lower back, that it is helpful to use a band that is about an inch wide. So this band will usually have about 75 pounds of resistance pull, which is what you want generally for the lower back. So make sure the stopper is in the door a couple feet up from the floor, like 1 to 2 feet or 1 foot up above the floor, because you want that traction to be pulling basically on this plane level here. Different than when you're doing the neck cervical traction, which you want about doorknob level, so that way your head rests in that cradle. So an easy way to kind of engage this is just kind of pull on some of the band so there's some slack at the end, and then start to scoot back on the mat with your feet on the outside, so this way you can kind of get some traction to get back far enough. And make sure you have your pillow or block or something set up already. Lay in your back, and the bands are gonna go between your feet here. So if you start off like this, make sure the band is between your legs here. And just adjust the band so that it is low on your hips here. So it's high up on the fold here between your torso and your quadriceps. Make sure you tilt your pelvis back, and then you should start to feel a little bit of pull here, maybe like 25% pull. And then you can grab the band or grab your pants and give it that extra push. Just kind of lock your arms out or push straight down on your thighs. You should really feel that separation at your lower lumbar area, L4, L5, and S1. Great for people with bulges, herniations, or sciatic pain or hip pain associated with those bulges in the lower back. So what I like to do usually is posterior tilt. I'll start off square. I press and I count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. This way there's still some pull and you're still feeling some traction, but not as intense. I count to 10 again to rest, and then I count to 10 and I push again. And I'll keep repeating this cycle over and over and over again until I start to feel very little pain at all. That pain should eventually start to get pushed out. And initially, you might feel a lot of soreness, a lot of stretch, but if you find yourself doing this 15 minutes, 20 minutes, it might take that long until a lot of that decompression has been removed. Another thing to do, if you're having one side of sciatic pain or one side of lower back pain, way more on one side than on the other side, the involved side, that's the side that you're going to figure for your leg. Your ankle is going to go on the opposite side here. And then with two hands, instead of putting square pressure here, frame pressure, you're just going to go on one hip side, one inside leg here, and press. And you should feel that whole side open up, that especially that sciatic side, if you do have it on that side. It is an amazing relief here for this. And the same thing, I'll count to 10 or count to 15, count to 10, count to 15, depending how far along you've been doing this for. Press, hold, breathe. Make sure you're taking deep breaths in and all the way out, and then relaxing. And then keep repeating that the whole session. I would do the opposite side as well, but if you're not having that much pain, you might not feel that much pain or relief on that side. So those are two things to take into consideration. Make sure you're posting, tipping your hips back. Towards the end of the session, what I like to do is kind of engage my hips here. So I'm gonna go posterior, and then I'm gonna lift up a little bit and do little kind of pumps here with like the glute bridges that we went over in the course. And then when you're going to relieve this, just let one leg through, and let go of the band. And make sure when you get up, you go to your side and press up to get to your side, just like that. A couple of things to take into consideration here are to do this at the end of the day before you go to bed is usually better, because this way you're maximally opening up, plumping up those discs again, and then that way you're laying down throughout the whole night. So you're allowing those discs no pressure while standing or sitting. So this way you open it all the way up, and then you're not just going to a standing position and then having that disc compress again. So this way you're able to go to sleep and you're getting that disc healing all night long. So you're not having any compressive force in it. There's no gravity putting down pressure on it. Also, drink a lot of water prior to doing this. Try and drink a lot of water the hour or two prior, and you can even put some salt or Celtic salt or sea salt or pink salt in the water. So this way your muscle tissue and the soft tissue of the body absorbs and holds on to that water, kind of structures it a little bit, just a little bit. And that disc will pull in, hydrate from the surrounding fluid in the tissue around it and pull it in while you're doing this exercise and plump up that disc again. So it's so important. If you're not hydrated, you can feel a little bit more soreness after doing this traction exercise. So it is something to be aware of, that you do want to do that. You want that disc to pull in fluid from the surrounding tissue to plump back up again. So this is an amazing exercise, a drill to do for your lower back. It takes the place of the traction machine that I have in my office that I treat all my clients with lower back bulges or sciatic pain. We go right to the traction table first and start the session off that way, and then I do all the unwinding work on them after. So this will kind of take the place of that at home for your home routine. This has gotten me out of pain for sure. You want to do it until you're out of pain, and then go lay down. So this way you're starting to create more time out of pain than in pain. And this is a great way to rehab on your own your lower back disc tissue. Thank you.